We come across people all the time who have encountered their loved ones are encountering dealing with the diagnosis for the first time, who are very frustrated with what's happening within the medical community and just not being prepared to help. Oftentimes, it may be dismissed, unfortunately, as just being age, when in fact it's really something more significant that needs to be analyzed and diagnosed.
This is at the core of the value of the memory care program. We have real experts in different aspects of what it means to take care of a person with a memory problem.
I was doing things that I normally wouldn't do, and I couldn't figure out, why this was happening, and now, I know why, and so I can, adjust.
We're not traditionally very good at thinking about the disease from the patient's perspective.
I mean, I've never been sick before in my life, really, so this is all new.
It's really very patient-oriented to provide, I think, a program which enables them to access expertise about all aspects of their disease. Neurologists might be interested in the biology of the brain, right? The psychiatrist might be interested in the behavior. Social worker certainly understands a lot about accessing services in the community. The neuropsychologist is expert at understanding all the various cognitive domains that are involved, how they relate to one another, and can help us with our diagnostics. The geriatrician understands about the adverse impact of what we call polypharmacy, the fact that many of the patients come in on many, many different medicines, or the complexity of multiple different medical illnesses that older patients often are burdened by.
If it wasn't for them, you'd just be out there not knowing, what to do, how to cope.
I'm not saying that every patient who walks in the front door accesses every one of those providers, but every patient who walks in the door, there's an opportunity for them to access those providers as deemed appropriate, and that's something that the team itself sifts through. We're in a constant practice of relying on our mutual expertise in the best interest of the patient.
Let me know what's going on, what I can expect, in the future, or what they think might happen. They're pretty, straightforward, which I like. The people there have always been really helpful.
Our whole philosophy is to work really closely with the referring MDs and to sort of think of the patient's primary medical home with their doctor and us as a room in that home.